that everybody looks forward to, both at the state level and locally in all the various regions. And so kudos for you in order to get this going. So we're gonna go right into it. I am Ann Bevan. I am the director for developmental disabilities. Now I have a new name. It's High Needs Support. Information will come out about that. But we support the developmental disabilities waivers along with some other housing and employment efforts. But here, most pertinent to you, the DD waivers. Nicole, did you want to introduce yourself?
Yeah, good afternoon, everyone. My name is Nicole Martin. I'm the director of the Office of Community Living here at DMAS. You know, to kind of reiterate what Ann was saying, yeah, this is a new era. Doing this virtually this year. We are happy to be here to share information with you. At DMAS, I oversee the home and community-based waivers, the administration of those waivers, and specialize in the CCC Plus waiver. And so, Ann, I'm going to turn it back over to you so we can go ahead and get started.
Okay. So today, and we reached out to Lucy, and Lucy, thank you. We really wanted to tailor this to what you wanted versus what we wanted. So we're going to try to cover what Appendix K is, and people have probably heard about Appendix K. The ARC did some great advocacy at the beginning of the pandemic to get us to utilize that flexibility that was available to us. And so we're going to go over some HCBS information, home and community-based and long-term support services, some provider qualifications, things about assessment, evaluation, and your person-centered planning, and retainer payments, all under that Appendix K umbrella. We also thought maybe some EVV updates might be helpful to y'all, where we are with the DD waiver slot allocations. She also said that maybe you had some information or questions on the Medicaid health insurance, and I've done my best to try to answer some of the preliminary questions, but I am not the expert. And then also the status of the regulations. So I'm going to pass to Nicole, making sure, Nicole, can you confirm that you can see my screen?
I can see it, yes.
Okay.
Okay, so like Ann said, we're going to talk about the Appendix K. So what is Appendix K? In Virginia, we have what's known as 1915C waivers, or these are the home and community-based waivers. So when we talk about the DD waivers, the community living waiver, the family and individual supports waiver, the building independence waiver, and the CCC Plus waiver, those are all 1915C waivers. Appendix K is something that the federal government has afforded us during times of disasters, whether it's hurricane or a pandemic. We can apply to have some flexibilities for those waivers. So we can make sure that the waiver operations continue during a state of emergency, so we can make sure that people are able to continue to receive services. And we may have to change a little bit on how we're doing those services. So that's what Appendix K affords us to do. Virginia did submit Appendix K applications that were approved. We are going to talk a little more in detail, but some of the things are like retainer payments. These are payments that support providers that aren't able to provide services, or telehealth. And I think one that you may be familiar with is parents being able to be reimbursed for care of minor children, and a lot of waiving face-to-face visits. So we're going to go into more detail about what's currently in place, and talk a little about what's on the horizon. So Andy, you want to go to the next slide? Okay. So what's in place now? Electronic methods of service delivery. So this means telephonic visits, video conferencing, allowing services to be done remotely. where the provider is not in the same place that the person receiving the services are. So we put in place telehealth, or allowing telephonic or video conference for case management visits, supervisory visits, routine and reassessment visits. And also there are some actual in-home supports being provided through telehealth and remotely. Another flexibility that we requested was to allow people to stay on the waivers, even if they aren't receiving services. Generally, services need to be provided every 30 days to show that the person actually needs the service. But during this period of time, there may be a number of reasons why people may not be receiving services. And so we are now allowed to have people stay on the waiver even if they haven't received services monthly. And we do that, and we just make sure that we're monitoring them. So that monitoring can be done by your case manager. It can be done by a care coordinator, or it might be actually even DMAS is making some monitoring calls for those in fee-for-service. So we felt like that was a very important flexibility to maintain, because we didn't want people to lose their waiver because they couldn't receive services. We also made some flexibilities when it came to particularly personal care, respite, and companion services. Worked with providers, and they identified that for agency-directed services, new providers, new aides or attendants needed a 40-hour training generally. It's standard. It's been the case for quite some time. But providers expressed that they were having trouble getting new aides trained prior to providing services. So we were able to do a flexibility that allows them to demonstrate that the aide is proficient in providing services, and gave them additional time to get that 40-hour training completed. I believe it's 90 days. We also have some flexibilities related to criminal background checks, specifically for individuals over the age of 18. Generally, providers would have to make sure that those background checks are complete prior to that individual working. Now they may work up to 60 days without that background check. For consumer direction, there is a caveat, which will go with the next point, with parents and spouses that are able to now be able to be permitted to be reimbursed for personal care. Those parents of those minor children can work up to 60 days while that CPS or check is being processed. We do know that that takes quite a bit of time. So those parents are able to work 60 days without that particular check. I do want to point out, we have started to get concerns from folks who are using this flexibility. It's currently slated to end August 31st. DMAS is looking into extending this flexibility. So we're working on that right now. And there'll be more to come in the next couple of weeks about that. But just, want to let you all know that that is something that we are acutely aware of, that it's a need, and we are working to get that extended. Okay. You're on mute, Ann. There you go.
Yeah. Okay. So one of the other things that was really important, particularly in the DD waivers, we have a lot more services there and might need flexibilities in how they're delivered and so forth. One of the things that we tried to work, and props to DBH working with us and trying to figure out some of this and what we can do. We looked at, under the normal scheme of things, group day, community engagement, community coaching, they're all services that would be delivered in the community. We want them to integrate. We want them to be part of the larger community and not segregated and so forth. And so they're very specific allowable activities. around that. But during this time, we tried to look at alternative settings. There are people in their own homes, their own apartments, or group homes, or sponsored residential that need supports, because usually, while they may be responsible to ensuring that there are available supports 24 hours a day, in reality, some of those services are provided by employment or a group service of some sort. So we looked at the delivery of group day, community engagement, and community coaching in residential settings, and also allowing some telehealth around those. We did allow that in private homes. So, Susie Q lives with mom. It was an opportunity for her to continue her involvement with other people. So that it's not just mom and she all day long, and she gets some of that stimulation and ongoing training. A lot like schools, where in the summer you worry about people losing skills or not having those relationships that they're used to for 9 months of the year. We thought about that as well. Another option related to settings was around, there's an HCBS settings rule that says that an individual that lives in their home, group home, sponsored, so forth, that they can choose to have visitors when they want. Well, COVID-19 really posed some problems for that. If they can truly have someone, and we do try to honor that as much as possible, there are times where a group home or sponsored residential or supported living provider may have to say, no, we have a COVID case, or there are people in the home that are at risk. And so they really try to weigh allowing the individual as much choice as possible with allowing them into the facility and potentially posing a risk to everybody, including the individual. So at this time, they are allowed to restrict the visitors. I have to say, I've heard lots of creative things that they're doing, having them on back porches, keeping the social distancing, things like that, doing video conferencing, just so folks are maintaining those relationships, but they are allowed to not have them in the home, at least for a little while. One of the other things that we had were retainer payments. There are some really creative things that states have done across the country, looking at how to preserve the provider network. We need providers so that they can help support everyone. But this is a super tough time, just like it is with restaurants and a whole lot of other businesses. So we looked at retainer payments. We were permitted in May to move forward with retainer payments that had to do with adult day health, which is under CCC plus, and fee-for-service, group day services, community engagement, community coaching, not community guide. I'm sorry, that's a error. We could not do it for employment services because of the way that CMS sort of defined the allowables under the retainer and the flexibility. But we've had, it went back to March 12th. Day support providers were allowed to bill up to a certain amount to kind of retain so that they can stay in business and gradually have folks back. They are allowed to deliver services if they're able to do that in a safe way and bill retainer, but not for the delivered services. There were limits to when the retainer could be done and for how long. That did end on 7/31. That was as much as we were allowed, and so that ended. While this is very provider centric, it's important to y'all because you need to know that your provider is going to be there when you're ready to come back. And I think, Nicole, are you doing telehealth? I'm sorry.
Sure. I think
I couldn't remember.
You bear with us. So for telehealth, our telehealth update, as we have gone into this, new world, we've seen that telehealth can work in a lot of situations, and it can work a lot with different services. So we are looking to see what could possibly be, a long-term telehealth solution for certain services, even after this emergency period is over. So, we just wanted to put a slide in here to talk about that, just to let everybody know that, we, this has not been, ideal. We are, learning and growing through this process. And, I think you'll see some changes with services going forward. Okay. We did want to give you a little update on electronic visit verification, or EVV. We did launch EVV back in October of last year, and we provided a transition period. We knew that it would be, we wanted to give people time to ease into it. And we also, back in January, extended the transition period once again for agency direction. And so I'm going to talk about agency direction and consumer direction a little differently because they're being implemented differently. For the agency side, agencies have to purchase and implement their own EVV system. And in order to ensure compliance, we are tying that to their claims, meaning that after a certain date, if the claims don't have EVV information, then that claim won't be paid. So that's why you're seeing the extensions on the agency side, because we really want to make sure that they have enough time and to work out kinks before we go to the point where we'll stop paying their claims. The consumer directed side is a little different. It's more of a timesheet kind of thing. So the EVV system has been provided for consumer directed attendants and their employers. And so we have been going steady since January. We are at about a 65% compliance rate. We aren't where we would like to be. We are starting to identify people who haven't been using EVV, and we're going to do some outreach just to make sure everybody understands, make sure that they have the appropriate equipment, and to see what we can do to troubleshoot why they may not be using it. There were EVV regulations published in the Virginia Register of Regulation back in January. We did get quite a few public comments we're reviewing, and we are currently finalizing those regulations for EVV. But what I will say, for agency directed, starting September 1st is when we will start to deny claims. Okay. You or me, Ann? I can talk. You're on mute, so.
I know, I keep forgetting. I'm sorry. The DD waiver allocations. So we, these are slots. I was going back and forth with Tanya a little bit. It can get very confusing as to what was introduced, what was approved, what is unallocated, and so forth. But over the next 2 years, we have lots of slots. There are 250 that are unallocated right now. These numbers that you're looking at include the 250. So we're being very, optimistic. It's very unlike me, and hoping that those make it through. As you know, there's another session beginning August 18th. We did just get, I think it was about 10 days ago, they approved our community living slots, and then our FIS slots were approved last week by CMS. So when the General Assembly says, here, take some slots, we are very happy, but then we also have to amend our waivers to include those slots, because they want to know how much is it going to cost, how many they are, and keep track of all the people that are in those slots. So that was approved by CMS. So your WSACs and CSBs and so forth should be reaching out. They'll be scheduling meetings and working with DBH and the regional support specialists to make sure that those meetings are occurring and reviewing all the individuals that are eligible. Ooh, okay. So this is going outside of my comfort zone, but I understood from Lucy that there might be some questions around the health insurance and co-pays and prescription supplies and determinations and things like that. So these slides are just some general information that I was able to reach out to our eligibility and enrollment people. If there are questions most likely around this, I'm going to probably need to refer you to that email, but I will do my darndest. So right now, if there a couple of things are going on with applications, and you will say at least there were a few hiccups sort of early on. They recognize that DSSs are closed. You might not be able to get in. There could be delays in getting applications or renewals or confusion and things like that. And some individuals need help completing those applications. So right now, the Medicaid eligibility start date is going back 3 months from application. During this time since March, and again, remember, not everything is perfect, but for the most part, there were supposed to be no reductions or cancellations related to eligibility due to failure to turn in the paperwork on time. Occasionally, because I worked with 1 or 2 cases where it happened, but it was sort of weird timing, and we were able to get that reinstated. Review is conducted in a month, 12 months post-application, if all information is required is available. Members also will receive notice stating that it has been conducted, and it will report that there were any changes. With prescriptions and co-pays during COVID, prior to COVID, it need to be ordered by a physician, but there are no co-pays for 90-day supplies for all drugs based on the public health emergency. There's also no co-pays for children. There are no co-pays during the public health emergency in general. I think that there is a distinction between a copay, the $15 you pay to go see the doctor, versus a monthly patient pay, which makes you eligible for the waiver service that you're receiving. So for instance, some of you may have a $200 patient pay a month that goes to the residential provider, whether it's in-home support, supported living, things like that. That still stands, but maybe there was a $5 copay for a prescription or something, or a doctor, and that was waived. So then, excuse me. Then below are just some of the copayment charges for individuals that are 21 or older, just as sort of some reference information for you. And I do not know if Lucy and Tanya will be sharing these, but we can put them in a format that will also be helpful if that is helpful. DD waiver regulations. So thank you to the ARC. Tanya and Lucy set on our special advisory group for the DD waivers. We love their participation, and they always keep us grounded. The regulations went out last, I want to say May or June. It was a 60-day public comment period, and we had about 1,200 comments. Wow. And they were really good. Again, a lot of duplications, but they were really good. We went through those through the fall. Again, as you can imagine, it didn't happen overnight. We worked diligently with those and included as much comment as we could. So what happens from here? We had DBHDS, their OAG, our OAG, internal DMAS people, all kinds of folks, taking a look at what needed to change, what we needed to edit from the proposed period to make sure we were capturing all your concerns. We worked with a lot of stakeholders, ART, Virginia Board, even therapeutic consultation providers, to make sure that those regulations are as nice and clean as possible. Will there be something missed? Probably. Can't always think in the future, but they are in a much, much better process. Some of the things that changed, I just want to remind y'all from last year. Originally, we had 3 waivers, and there were 3 sets of regulations. And then there was a set of regulations for intermediate care facility for your VIDs. And then there was one for case management. Actually, there were 2. So there were like 6 sets of regulations that you had to look through to sort of figure out how this DD waiver program ran. Well, this was a wonderful opportunity. We were able to pull everything into one set, even though we continue to have 3 waivers. They all operate under the same regulations, and we were able to alphabetize them and all those really nice, easy things that makes it user-friendly to a provider or self-advocate that's trying to read what they're allowed to have and not. So went through all of that. We also had to work with DOJ, the independent reviewer, and some other folks to make sure that we captured everything that through the status conference with the judge and through new compliance indicators we needed to include in regulations because it might affect how a provider was operating. And things that they needed to do, like making sure their staff are competent, things like that. So we got all that information in. We made all our edits. The regulations are actually being reviewed by our DD-WAC, our DD advisory group, waiver advisory group, of which the ARC is a part of, as well as providers, SILs, and other advocacy organizations. They are reviewing those to give us any preliminary comments or concerns that they might have so that we can try to address those before doing it through a really formal comment period. Once we get all of that collected and added into the regulations, they will go back to the OAG, they will get certified, and then they will be posted for another 30-day comment period. We'll send that link to all of our stakeholders in that DD-WAC group so that they can make sure that you'll get a copy of those as well. And so that's kind of where we are. I can't say, oh, in 30 days it'll be done because I need to look at comments, but we are working diligently, and I do think that they are in a much, much better place than they were before. So lots of information. We want to give enough time for questions as well. Lucy also asked that I put emails for CCC Plus and DD Waiver, 2 very different programs. So you need to sort of pay attention as to what you are focusing your question on. But usually if I get something and it's Nicole's program, I send it to her and so forth. So those are our email address boxes. Lucy, Tanya, any questions you have for us? I have not looked at the chat because I don't know if it will affect my screen.
Oh, no, you're good. Don't worry. Lucy and Kim are both here and are ready to jump in to let you know what we're seeing in the chat box. Lucy or Kim?
Yeah, I'll go ahead. Ann and Nicole, thank you for following directions and putting together this nice overview. I think we have lots of detailed questions, which you're probably not surprised at. I want to start out with a few things. I know people who are using the flexibility as a parent or a spouse to provide personal care, respite, and companion are very glad to hear that DMAS is working on getting an extension on that. If there are parents and spouses who have not already requested this, can they go ahead and request it now?
Yeah. Yeah, and so if you have, if there's a parent or spouse that's interested in providing care, yes, they can continue to go ahead and request that. Start with the service facilitator so they could send the information to the fiscal agent. But I do want to clarify that it is only for personal care.
Yeah.
So it's not respite and companion, just parents and spouses. Parents of minor children and spouses are permitted to provide personal care at this time.
Thank you for correcting that. We also have a question about face-to-face visits. So with your services facilitator, can you all just go over a little bit what the requirements are as of August 1st and how people can do face-to-face, or if they really feel like they can't do a porch visit or whatever, what's the scene there?
And I'll jump in and talk about this. We are working on some revised guidance around face-to-face. You're correct that as of 7/31, we had expected to have providers return to members' homes to do visits. We are looking at that. We actually are putting out guidance. We hope this week that will say that face-to-face visits will continue to be waived for some period of time, with some just additional information about making sure that individuals are being looked at for health and safety, and some ways to do that. So we will be putting out another Medicaid memo this week to providers to let them know that we will have that face-to-face requirement waived for another stint in time, because the pandemic is still pretty much going strong.
Okay. So always communication and all these changes and getting information out is a challenge for us all. So at the Arc of Virginia, we try and put that information out as soon as we can. Nicole just mentioned it would be coming out in a Medicaid memo that will go to providers. We will try to get that up on our coronavirus website as soon as possible. And then Ann or Nicole, do you want to remind people that are on the call how they can find this information on your website?
Sure, and when we have Medicaid memos that are pertinent to the DD waivers, I do usually send those to the ARC so that they can get those out. There is a provider portal on our website, so if you go to dnas.virginia.gov, I can't do it now because I'm sharing this. I believe the bar up at the top, there's something that says for providers. If you go to for providers, it'll ask, it gives you different things like regulations and programs and things like that. There's a section that says provider portal, and you can look for Medicaid memoranda in there as well. And you can go by years. You can go back, 15 years, look for stuff. But again, I try to make sure that the ARC has that, but if you don't want to wait, even though they're usually Johnny on the spot, you can go to the provider portal.
Okay, we have a question in the chat. I don't know, Ann and Nicole, if you're seeing the chat. I can read it. We know many people with DD are not accessing services the same way they did before the pandemic. Is DMAS capturing the cost services associated with decreased utilization rates? Do y'all have anything you can speak to about that?
So I know we can. I mean, we can look at, for instance, the retainer payments yields a cost that might not have been there before, or may have been because now they're not getting services. We know how much are in retainer. There's probably some data analytics around that. I don't necessarily have that available to me now. The other issue is there are a lot of costs that aren't necessarily captured through Medicaid, right? I mean, we've got PPE that providers are having to purchase, not necessarily under our purview or something that we can tie back to a claim to assess a financial impact. I do know provider networks are doing a lot of that and the best they can in terms of trying to collect some of that data. Another thing that we wouldn't necessarily collect are the 24-hour settings like group home sponsored and supported living are per diems. But what's different? Talked about that before. They're having to provide for that day activity that they normally weren't. That technically is a cost that they didn't incur, but it's not necessarily something we would see at Medicaid. So that's sort of a loaded question in terms of, are we capturing utilization? Well, it depends on how you define utilization too.
Mm-hmm. Well, hopefully before long we'll have some answers to that. I mean, the more this goes on, the more data there is, so we find out things. There's also a question about, will people with DD be able to access telehealth options for community engagement and in-home residential supports?
So it's already allowed. We put, that was in the 515 memo, I believe, for community engagement, community coaching, in-home services. They were allowed to request, receive, if the provider was amenable, a telehealth version. Video conferencing, teaching them how to garden, how do you shop for your groceries, whatever. And there were guidelines in the memo about what they needed to do in order to provide that. You had to update your plan for support because normally some of this is not an allowable activity under what we have, but we were allowing it. How is it going to change? Maybe they got 60 hours a week of in-home services. Is it really realistic you're going to do telehealth for 60 hours a week? Some of those. So we asked for plans for support changes that would go into DBHDS to review. Some were asking for additional hours. And what was that going to be for? Is it telehealth? Great. Let me see your plan. That was allowed for those 3 services. And just so you know, therapeutic consultation, we were allowing some telehealth that's not normally allowed. For those authorizations that were in place March 12, again, to make sure people got supports and to make sure that, help providers remain viable. So that's already in place. We're looking at, as this goes on, do we need to consider this as allowable for new authorizations? Again, we were trying to preserve the existing, provider community and the supports and the relationships that they had with individuals. But do we need to look at that more broadly for an auth that comes in today? Do we need to allow in-home? So we're in conversations with that, and we're hoping that that will be in the next memo too.
Oh, I think that'll be good news, because I think there's a lot of people who would like to have more and more access to telehealth,
Right.
which then leads to the questions about availability of the devices, the computers, et cetera, that people need, the technology to be able to communicate and have access. So in the waivers, people may have up to $5,000 worth of assistive technology. So if someone needs a computer or some device to be able to manage in this world, especially now with COVID, how do they go about that?
Yeah, that's excellent. Now, I'm so glad you brought it up, because I think sometimes people forget what they have available to them. And, this is even, this gets me, Jones, I'm sorry. This even goes to people that live in group homes. You're like, oh, well, the group home has a computer. Okay, well, why can't that person have their own computer? Again, they need to know how to use it and so forth, but if they have an iPad or a computer or something small that they can use, that they can video conference and engage, that is absolutely something that can be considered. Again, assistive technology, not an environmental mod. Assistive technology, looking at that, completing, go through, I want this iPad and here it is, and making that request through your support coordinator into WAMS to DBH to then be approved. Pretty simple.
So start with your support coordinator.
It always, yeah, and depending on who is, again, if someone lives in a group home, you have a lot of people that can really might be there to be able to help someone that lives on their own in their own apartment, might need a little support, but generally support coordinators and case managers should be able to help you with that. And I'm assuming, Nicole, that would be the same on CCC Plus if they had a support coordinator or a service facilitator.
They should go to their care coordinator if they are in managed care. Yes.
Okay.
Okay. Maybe can we flip back to the slide that talks about the new waivers? There seems to be some confusion about that.
The slot allocation?
Yeah.
Yeah, good luck, because Tanya and I were talking about this. I will do my best to answer. Okay. What about it?
So could you just go back and clearly, not that you weren't clear before, but go over like how many waivers are going to be available for distribution in the next couple weeks, months, whatever, and which types of waivers?
Right.
Available.
So there should be a total of, and Nicole, you always step in.
You're right.
785. Is the 25 part of the 785? That was the only thing I was wondering.
Is the 25, I'm sorry. Oh, for fiscal year. So the way this chart is broken down, it is by fiscal year. So we are in fiscal year 2021. So this year, I guess we would have to add, and actually I did add earlier. Let me see if I can even locate where I added it, just to make sure it's correct. But I will say for the CO waiver, there are 160 slots that were approved. And for the FIS, there were 650. Well, let me make sure.
This year they're looking at 700, and what I'm trying to find out is I have 785 for this fiscal year. Next fiscal year with the 250 would be 550, but we have the emergency slots. Are those 25 emergency slots part of the 785 or in addition to?
They are a part of it. So okay. Yeah, now I know what you're talking about, the 25. Those are the facility slots. They are incorporated into that, the first slot
785
figure.
Okay.
Yeah.
So then the 550 next year, which they could be given out as early as July of 2022, is 550, but that includes the 250 slots that are unallocated in the budget right now that could be brought back in August, but we're being optimistic. And the 25 emergency slots is part of that 550.
Yes.
Okay.
Lord, Lucy.
Okay.
Yeah.
So I know there's some people on here who are waiting for a waiver. So I just want to make sure I've got it clear. So in the next month, couple weeks, the CSBs will know how many waivers they're getting. And then
For sure. I will tell you that DVH did send something out probably a month and a half ago to say, based on the tentative stuff that we're getting, we estimate that your CSB is going to get X amount of slots. Start, preparing that process. They usually do that every year. And then Dawn, I talked to yesterday, about confirming those numbers. So she's working through that just to confirm with each CSB how many slots they have and what they're doing with their WSACs.
Okay. So for all of you who are anxiously awaiting to find out when the waiver slot allocation meetings will be, please be in touch with your community services board. Make sure your waiver application documents are up to date.
Absolutely.
Ask for copies of those documents and just stay in touch with your case manager, your support coordinator.
Yeah, we really push. You need to talk to them, not just at the time of slot distribution. You need to be in contact every month if that's what it requires to say, my need has changed, my need has changed. You need to make sure that the accurate you is reflected in those records.
Okay, and speaking of waiting lists, there's a question about how many people are on the waiting list. Would either of you like to cough up this
We
figure?
don't have a most recent number, but it was right around 13,000 people.
Yes, so right around 13,000, and then you're only considered if you're in priority level 1.
Correct?
If you're on the waiting list, you definitely want to know what your priority level is. And there are about 34 to 3,500 people, last I saw, in priority level 1.
I do want to just make sure, while the allocation of slots was only in CL and FIS, and yes, what you said is true. If there were BI slots here, this would not necessarily be true, because there is a caveat that if there are BI slots, you do not necessarily have to be a priority 1 to be considered for that.
Okay, there's a question. If a day support provider is delivering some services during the months they are receiving retainer payments, can they bill for both? I'm not sure if you already covered that.
Yes, it's confusing. So let's say you normally provide 40 hours a week in day support, and they've been working with you trying to maintain services, and they provided 10. They can bill for that, deliver that, that's fine. Then they would bill and again, this is sort of invisible to a recipient, but they would bill 30 hours for the retainer payment. And the system catches it. If they try to bill both, it would reject. But yeah, they could bill a portion of the retainer over and above what they actually deliver.
Okay, so we have nearly 100 people on this call, and many, many people are asking if they're going to be able to have copies of these slides. So everyone who's on the call for all of the presentations during our virtual convention, they are being recorded. We have the slides, and within a few days, you'll be able to go access them on demand. So not to worry, you'll have a copy of all this information at your fingertips. So there's a question about moving between waivers. Let's say you have the community living waiver, but your needs have changed, and you probably need you want the community living waiver now. Can you briefly explain how that process works and maybe something about the timelines around it?
No.
Okay.
I would prefer that you talk to your regional support specialist around that. There is a proposed process. Remember, we have no regulations. So first and foremost, we have issues in terms of holding people to something, but there is language in the proposed regulations around that process. To simplify it, in essence, you have to be identified by your CSB as having a change in need. And there's a reserve slot waiting list that is separate from your standard larger waiting list. And it's by CSB and statewide too. So, you know, you get 3 from Fairfax and 3 from Lynchburg and so forth. It's going to be all in one list. So as a slot becomes available, let's say Nicole and I were at Fairfax, I need a slot. Nicole decides to move to Italy because she's always wanted to go there, gets up her slot. There may be a slot that becomes available. My needs, I'm on the FIS, I need to get a CL, that may be offered to me before someone brand new, because I'm on a waiver. I have to have all of my needs based on federal requirements. My needs have to be met. We can't just meet part of my needs. So that's pretty simple. It is a lot more complicated in terms of timeframes, who needs to do what, but if you believe that your needs have changed substantially, that requires a congregate level of care, group homes, sponsored, supported living, because those are the only 3 things that are different than a FIS. So it really needs to be about, you need a congregate level of care. Then you absolutely need to make sure that your support coordinator knows that your needs get identified and you can get on the reserve slot waiting list.
Okay. There are about 12,000 questions in this chat. So
So Lucy, why don't I propose that after y'all are good, if you want to kind of decipher all of that and put those in categories for us, we'll be glad to try to go through and provide answers or provide direction as to where they can go. That way everybody gets their question answered, even though we can't do it right now, maybe.
That will be wonderful. That's what I was going to suggest. We will put an FAQ together and get as many questions as we can answered. There are just numerous questions, comments about being able to access assistive technology and the difficulty with getting it approved. Some day providers are struggling to stay open, and the end of the retainer payments may cause some doors to close. Is there consideration to reinstate retainer payments?
There is not. It is a federal limitation. It's
Okay.
beyond our control,
Okay.
at
And
least at this moment in time today.
yeah, okay. Our support coordinators, our support coordinators and case managers being asked to improve access to technology and the internet. So I think we talked about that earlier. You've got to talk with your support coordinator. If you need any assistance with that, please contact us at the Arc of Virginia, or you can contact Nicole or Ann Bevan, who are right here on this call.
Yeah, so the way that question is phrased is a little odd, so I just want to make sure that we're clear. It's not the case manager's job to make something available. It's to help the individual get what they need. So if the individual expresses a need, they can't read your mind, expresses a need, you need to advocate for yourself and say, I need help figuring out, can I get this and where can I get this?
Okay, we have a question from Janelle Gilmer, and she's asking about what Virginia is going to do to promote greater health equity for Virginians with developmental disabilities. And Janelle, I suspect, is referencing the DD waiver wait list and meeting eligibility for waivers. And so if you're a person with a disability and you don't have a waiver yet, or you haven't qualified, what is out there for health equity?
There are a variety of state plan services that are available to help meet your needs. Of course, they're very limited, if nothing, related to long-term, your placements, your congregate settings, maybe personal care, things like that. But there are state plan services that can help you meet your needs through acute and primary care. You have MCOs that can work with you on your needs and help identify some resources that may or may not be paid for by Medicaid. And there are some programs at DBHDS, while limited, could offer some support to individuals. I think it's the IFSP program. And again, going through your support coordinator, CSBs may have opportunities that may or may not be paid by Medicaid. Not everything is paid for by Medicaid, but could be available to individuals. Nicole, did you have other?
No, I didn't.
Okay.
You did a really good job.
So if a person just has straight Medicaid, we say, and they don't have a waiver, they probably have a care coordinator. Is that correct?
Yes, ma'am. Most of them do. There are very few people. It's only like 2% of our Medicaid population does not have managed care.
Mm-hmm. Okay, so a person could contact their care coordinator to ask for assistance with resources and what might be available.
Yes, ma'am. But remember, some of those individuals that may not have waivers still have case managers that can help them too.
Yeah.
Yes.
Outside of the care coordinators.
Right, right. Comment, group day and skill building need to be allowed to provide distance learning, video conferences. Families and residential providers do not necessarily want face-to-face. I would also amend that to say individuals, families, and residential providers do not necessarily want face-to-face. Lots of individuals are not getting serviced and are losing vital skills previously learned, as well as learning new skills. I think that's just been one of the greatest hardships that's come about as a result of COVID. So hopefully distance learning, video conferencing is going to be a resource for many people that can use it.
And if we open this up, it's not available for group day. And honestly, it's not being considered at this time. But if an individual's need is representative, honestly, if it's one-to-one and it's Nicole working with me in a group home versus 7 other people like it would be with group day, that might be more appropriate temporarily for community engagement. And if we open this up to new authorizations, not just those that were standing in March, maybe that's something that you need to look at with your support coordinator or case manager to see if community engagement or community coaching or in-home services via telehealth is a more appropriate option in the meantime.
Okay, good. Thank you. Is there any thought being given consideration for internet costs to be covered through Medicaid?
Not to my knowledge. Nicole, are you aware of it?
I'm not aware of any thoughts, no.
So people would probably like that added to your list of things that you're working on. I'm saying
pass it along. I don't like to promise anything. We can pass all suggestions forward, but I know that even within normal limitations of the waivers, there are things that we can pay for and not pay for, but we can absolutely pass it on.
Okay, someone is saying that they don't have a support coordinator for their daughter who has CCC plus.
Correct.
Great Medicaid. To whom should I go? So we don't know if that's CCC plus waiver, which.
But whether it is or isn't, she's saying she's not connected with the CSB with a support coordinator, so she definitely has a care coordinator.
She may not actually, if she is not enrolled in managed care. And there are lots of folks who, it's a small percentage, but there are folks, especially I think about people who are enrolled in the HIP program that's not part of managed care. They have straight Medicaid. So it depends on what you're looking for, what service you're looking for. It's kind of like the straight fever service system. If there's a service that you need, then you have to look for the provider. If you already have a provider, if you have a personal care provider or service facilitator, they may be able to help you when they do their assessment. You tell them what your needs are. They may be able to point you in the right direction. But it's basically looking at our list of providers that's on the internet. On our website, you can look for the providers of the services, and in that way you can contact the providers directly with your needs. And if you ever have any questions, you can feel free to email us at the CCC Plus waiver at dmas.virginia.gov, and we can try to help you out.
Okay, we're getting close to the end of time, and there's just 2 more that I'll hit. One person is asking, what is the Community Services Board? Well, I always say Virginia does a good job of making things confusing. Community Services Boards are your local provider of mental health, developmental services, and substance abuse. And in some places, they're called different names, like Richmond Behavioral Health Authority. But if you have a DD waiver, then you are connected with a Community Services Board. The Community Services Board does not manage or handle the CCC Plus waiver. And then there are all kinds of questions and comments about wanting to know more about the cost savings because of lower utilization. And we will put the chat questions together and get as many answers as we can. And again, all of this will be available on our website in a few days. So any parting words or comments, Anne or Nicole?
No, thank you so much, Nicole.
Yeah. I thank you for allowing me to be here. I know Anne did the heavy lifting here because you're more interested in the services that she provides. But always, if there are any questions about the CCC Plus waiver, please email us. We are happy to do our best to assist. And if it's something that, you know, we don't know, we'll get you to the right place, whether that's Ann or someone else. But always, you know, feel free to reach out to us.
Well, thank you very much. I'm sorry we can't all clap for you and clap for ourselves, getting through COVID times.
That's for y'all. So.
Okay, thank you very much.
Thanks,
Bye-bye.
guys.
Thank
Right.
you.
Bye.